Perfect. Perfect. Thank you. Hi. Thanks for having me. I'm a Minnesotan. I have to say that whenever I come to Minnesota, so I'm proud to be back. Thank you. Thank you very much. Hi. People never applaud for that. You're a Minnesotan. You all are all Minnesotans too, many of you. What I want to talk about today is, I know David talked a lot about technology, and I'll get to that, but I want to talk today about something really much more fundamental, what I regard as maybe the biggest problem in healthcare and medicine, which is getting people to do what they already know they should do. So if you look at the statistics, something like 50% of mortality in this country can be traced back to personal decisions. Sometimes somebody had a choice and they decided to go on a different path, the wrong path from a healthcare point of view. Something like 70% of our healthcare costs are related to these conditions, things like obesity, diabetes, heart disease, many forms of cancer, it's things like smoking. That is bad decision making, right? People have the opportunity to choose and they choose poorly. So what I want to talk about is how do we get information to people in a way that helps them choose better, right? Should be simple. Let's solve it. So I want to instead of going to technology, I want to go way back. I want to go back to 1981 and to talk about a study from what could be considered a rather mundane and pedestrian part of medicine, dentistry. I apologize to any dentists in the room, but it's true. You guys have a pretty straightforward job. It's prevention. It starts with prevention. Brush and floss. And that was this experiment in 1981. They wanted to see if they could get people to brush and floss, and they decided that the way that they were going to do that, the variable that they were going to manipulate, was fear. They wanted to scare people into brushing their teeth. And so they told them for 13 minutes, about as long, where's my clock? About as long as I guess I don't have a clock, about as long as I have to talk to you, they were going to just scare them about brushing and flossing and what happens when gum disease wreaks its way. So they actually divided, they had 80 patients. This was a study done in Connecticut. They had 80 patients. They divided them into 4 groups. And I'll just tell you about the low fear group and the high fear group. So at one extreme, they had a low fear group where they told them about basically the things that would happen if gum disease went its way. And they talked about basically your teeth would bleed a little, your gums would bleed a little bit. Eventually you would lose your teeth, you would get dentures, but probably you would be able to still eat most of the foods you enjoy eating, and you would go on with life and you would make your way. The high fear group, the message was very different. They showed them images of, bear with me, they showed them images of pus oozing from between their teeth. They showed them pictures of people with their teeth dropping out. They made it really, really bad. They talked about infections that would start spreading from their mouth to other parts of their bodies. And they said, yes, ultimately you will get dentures. And those dentures, they aren't that great these days. You basically will be able to eat mush. Corn on the cob is out. Steak, it's out. Fresh apples, those are out. Go brush your teeth. That was the message, right? So they had the high fear group, the low fear group, right, and those two in between. The other thing that they measured was their efficacy. So they wanted to know whether the people felt that they were actually going to go ahead and follow the behavior. So they had some people, they kind of split into 2 groups. So they had people who thought that they were probably going to go ahead and behave well and do what they were told. And then people who thought, actually, you know, it's hard for me to get around to these things and I may not follow the behavior. That was the experiment. They didn't try to manipulate efficacy, but they manipulated fear. They pushed that fear button really hard. So what happened? They came back after a couple of months and they measured, and here's what they came up with. So the difference between the low fear and the high fear group, there was some, right? The high fear group did have some more brushing and flossing than the low fear group. But the low fear group really, the fear was not the real driver here. The delta was coming on the efficacy side, not on the fear side. The experiment showed, back in 1981, that fear doesn't really work in terms of communicating health messages. So what have we learned? How do we put this into action? Not very well. This is an ad from the New York Times that Memorial Sloan Kettering ran. They're a great institution, but they're basically telling anybody who's over 50 that they have colon cancer. That is a lie. That is a statistical lie. And does it work? I don't think so. Likewise, we're telling people that diabetes is going to come and kill you like an assassin. We're saying that something as benign as salt or seemingly benign as salt is going to be kind of rooted for a catalog of diseases. These messages don't work, and they don't work because you have to remember the context in which people are receiving them, right? We're receiving these scolding messages, these tisk, tisk, tisks, amid exactly the contrary messages. So which message here is actually making you feel good about food, right? It's not the one that the public health people are trying to sell you. So we know what happened, right? We know how this plays out. So these are the obesity rates. We've all seen these statistics. These are the CDC obesity rates. And obesity is really a surrogate for this whole kind of host of conditions where we have some agency. Smoking decision matters, even compliance with taking your pills, that's a decision, and we don't do very well. We have to invent new colors to convey how poorly we're doing in decision making. That's the problem. So let's go back to this chart, right? I'm not gonna go all doom and gloom. This is the chart, and what did work here is efficacy, right? So let's talk about efficacy. Let's talk about what that is. It's an idea that Albert Bandura popped up with in the 60s and 70s. It's a great idea. It basically means that individuals believe that they have a role in their health, that they have an actual role to play, that they can change their health. That's a very important thing. They can see a path towards better health. They can actually envision themselves getting better, doing better. And when people have that sense, they make better decisions. So how do we increase that? Well, personalized information works. We've known this for actually decades, back since about that 1980 study. Personalized information, when I tell you information about you, when I'm not doing these kind of blanket fear-mongering statements, but when I'm telling you about where you stand in your health, that tends to help you move to a better decision because it's amazingly relevant, right? All of a sudden, it's not just kind of this cacophony of information, but it is information that's about you. It becomes relevant, becomes meaningful, and it helps you make an emotional connection. Now, this is something that medicine oftentimes isn't comfortable with, but to me, it's this huge issue that we leave it to the health and wellness communities to talk about emotion. And clinical medicine is over there talking about rational information, and they're giving you data. Well, data only works in terms of behavior change when people are able to make an emotional connection with it. So that's what personalized information does, and it brings you to an action, right? So that's basically, those are the ingredients of a feedback loop. So you give people those kind of, you kind of put into effect that kind of catalyst towards change. And they're really effective. The problem is, so far, until recently, is that personalized information is pretty expensive, right? In order to get targeted information about you and deliver it back to you, that's an expensive proposition. We can do it, but you have to go to Club Med, say, to have that experience. This is the Club Med Cafe. I stole this from their brochure. You go to the Club Med Cafe, you will get a menu tailored just to you and your goals. You can have yoga. You can do yoga on the beach at exactly the time of day that you personally feel most meaningful. Maybe just time it perfectly to when the sailboat is going by and the sun is setting. That's the time I'd like to do yoga on the beach. But that's expensive, right? That doesn't scale. That is not kind of healthcare that we can actually deliver to the masses. We can go to the Mayo Clinic. We can hit the amber fields of southern Minnesota and get the best medical care on the face of the earth. So you talk to people. I mean, I've had family members who have come to the Mayo Clinic, and they talk about it as a singular experience. And it's a wonderful thing that those of you who work at Mayo do, but it's not common, right? The idea that kind of what Mayo does so well is they give people an experience where they feel that they're individuals. They feel that they're actually recognized as human beings. The information that they're given, all that healthcare information, is personalized. It's emotionally relevant all of a sudden. They're not just another cog in the healthcare chain. But again, that doesn't really scale. So here's where we are. This is the big move now. Personalized information is all around us, and we're able to capture it, and we're able to deliver it in ways that don't require the huge apparatuses of a Canyon Ranch or a Mayo Clinic. So here's a quick example. We're all familiar with this, right? These are the your speed is signs. This is a great feedback loop. This is a perfect feedback loop. They're really effective at getting people to change their behavior. So I'm going to play this out according to the little feedback loop matrix. They give you a very clear read on what the basic information is, right? The basic speed limit, you want to know that, and then you want to know where do I fit in that. So you're going 32 miles an hour. We're all probably speeding, right? Whenever we go by these things, we're actually going faster than we should. So then we make a decision. We make a decision that we should probably slow down because maybe that is connected to some kind of cop car looming around the corner. They never are, but we still think they are. And the action is so easy. We just lift our foot off the pedal and we slow down. That's a feedback loop. It works. It's if only everything in healthcare could be that easy, right? It is in some ways a healthcare move. I mean, your blood pressure probably goes down as you reduce your speed. There are fewer accidents, but it's not the kind of thing that we're here to figure out. But how can we use that kind of mechanism in health? Where is that? How can we spread that tool? Well, here's a good example. This is a website, lifemath.net, that comes out of the Laboratory of Quantitative Medicine at Harvard University. And they've taken the screening recommendations that the US Preventive Service Task Force has worked up that apply to every American. And you can go to the US Preventive Service Task Force and get a kind of rundown of what screening tests you should get for various diseases. Now, the folks at lifemath.net have taken that actually a step further. They've allowed you to enter a few particular points of information, not a lot, but just a few. Your age, your gender, your smoking, whether you smoke or not, your weight, your height. And they give you a list of screening recommendations, but they also give you a list of simple behaviors that you can do, and they deliver the impact of that in terms of days added to your life. So in my case, if I was to start taking an aspirin a day, I would gain almost a year of life. So that's a profound transformation of data from this abstract raw form into a new kind of narrative, right? I mean, talk about an emotional connection. I get a year of life. Why wouldn't I want to do that? Here's another example. Maybe some of you have this thing in your pockets right now. This is called the Fitbit. It's a very simple tool. It's an accelerometer inside there. It's basically playing on what's called the Moore's law of sensors. So cheaper and cheaper sensors are able to gather information. In this case, an accelerometer that you wear on your waist is able to gather your how many steps you're doing, and therefore correlate that into your calories burned and all sorts of other information. It can measure how well you're sleeping. And so it's great data, right? It's personalized data. But and you can go to the website and kind of check your charts. They don't look unlike the patients like me charts that Jamie showed earlier. But they're kind of your general life summed up. All of a sudden you're harvesting this thing that's called data exhaust, this idea that we're spewing all this information. It's captured by this device. But it's not just numbers. It's not just for data geeks, because there's this wonderful little tool on the surface there, that blue flower. The more you walk around during a day, the more activity you do every day, the taller that flower grows. So you don't have to look at the numbers. You don't even have to plug it in and connect it back to your computer. You just want to get that flower to grow, right? That's a pure emotional kind of game that you're able to play. It's incredibly rewarding, and it works. It's a great feedback loop. So I want to go back to dentistry. I don't want to kind of sell dentistry short, because they've been working on this too. There's this nifty experiment that was done in Japan a couple of years ago, where they took sensors, again, Moore's law of sensors, and they attached them to the end of a toothbrush. And they had basically a video of a kind of a video game of a aquarium. And so the more people brushed their teeth, they had to brush their teeth twice a day for 3 minutes at a time. And as you brushed your teeth more and more fish would start to populate. They'd swim faster in the aquarium. They'd lay eggs, so you get more fish in your aquarium. It worked. It was a very simple feedback loop that encouraged people to do what they need, what we all know we need to do. And they didn't need to scare people in order to get them to do it. So I just want to kind of lay out how this works in general. So the idea here is that these feedback loops are powerful because they give us positive information, right? It's not fear-based, it's not scary information, but it's positive information about us, where we stand in kind of a context. And it helps us under that context, that kind of visceral connection with the information resonates emotionally. And not only that, we can start to visualize how we could start making better decisions, make new choices, and embark on a different path. And the most important thing here is that we connect that information to an action, to an opportunity for action. And it needs to be an opportunity for action that is not just kind of finite, you know, that doesn't exist at one point in time. Because as much as we want to, we will never be perfect individuals, right? I mean, those obesity slides are testimony to the fact that we know what we want to be doing, but there are times when we're going to be making mistakes. And we need to know, we need to make it clear to people that it's never too late to start visualizing their better path. And it's never too late to start acting and making better decisions. And so to me, that's what's so powerful and so quite frankly stirring about this idea of feedback loops and about using technology and new tools and new sensors to deliver information to people. And I should say, be very clear, because you're going to hear more about it tomorrow, good design. Design is absolutely essential to this process. To deliver feedback loops to people and start making all sorts of decisions possible and visible to us that may not have been. And what happens when you get that emotional connection is that all of a sudden we stop fearing our health. We stop seeing it as this kind of nagging source of anxiety. And we can start seeing it as actually a story that we're not only kind of want to know what the ending is or want to know what the chapters are, but we feel like we're the authors of. We feel like we're writing it. Thanks very much for your time.
You're a natural.